This is Smarter Patients, the show that teaches you how to survive the American healthcare system one sick day at a time. I'm your host, Alana Jacqueline, author of the book Medical Gaslighting: How to Get the Care You Deserve in a System That Makes You Fight for Your Life. My promise to you is that in 15 minutes, I can make you a smarter patient, more capable of surviving the chaos that is today's healthcare. Follow along with me here, and after the episode, make sure to check out smarterpatientspodcast.com and get the full episode guide with resources, checklists, and ways to share this micro podcast with those who may also need to advocate for themselves. I'd like to take a minute to thank our sponsors. Unfortunately, this is still another pilot episode. So in that case, I'd like to thank the inventors of ketamine, who are partially responsible for me not having a trigeminal neuralgia flare today. Ketamine, not just for the club. Let's dive into the episode. It's a beautiful day. The sun is shining. The birds are singing. Your coffee has just the right amount of milk in it. You log into your corporate remote job and something is off immediately. All of your appointments for the day have been canceled. There is only one meeting now. It's 15 minutes long and Jessica from HR is invited to it. Your stomach feels like it's going to fall out of your butt. Your blood runs cold. You hear ringing in your ears. You can't get fired right now. You're scheduled for a minor surgery in a few weeks. Your kid has their annual checkup tomorrow. Forget the paycheck. You can't afford to lose your insurance during a layoff. I'm sure it will offer you no comfort to know that you're not alone in your terror. Amazon has laid off 30,000 employees. Starbucks has laid off 2,000 of their corporate workers. And that's just the top of the pile. Companies all over America are leaving employees to fight for severance and figure out what to do about losing their health insurance. If you get laid off, or there's a chance that you might, today's episode is one you're going to want to bookmark. We'll cover what you should do immediately and how to navigate the basics of COBRA. Here's how to be the most depressed person in the unemployment line and still be the smartest patient in the exam room. Most large employers usually end coverage on the last day of the month in which you're terminated, not the day that you're fired. So if you're terminated on October 28th, your insurance would likely continue through October 31st. However, and whoever your employer is, make sure to verify this with HR and your benefits portal right away. And don't forget to ask, does dental and vision coverage end the same day? This determines how much time you have to schedule care. Next, take out your phone and start scheduling doctor appointments. Move up any procedures, surgeries, or well visits that you have scheduled, especially labs and tests, so they're completed before the coverage expires. Tell your doctor's office exactly what your situation is. Many healthcare workers are getting the axe too, so chances are that they'll be sympathetic to your plight and usually do their best to fit you in. Now let's talk about COBRA, which is governed by federal law, not your employer's discretion. My husband and I both went on COBRA during his last job change, and while it was a hefty bill, it saved us what could have been thousands more for our infusion medications. If you're going to dive into your savings, 401k, or any other emergency funds, COBRA might be the most important thing you could spend it on. Here are some quick facts about COBRA. It lets you stay on your exact insurance plan from your previous employer up to 18 months. You pay the full premium, what you were paying at your job, plus what your employer paid in fees. You have 60 days from the last day of the last month of your employment to apply. Once you enroll, coverage is retroactive back to your lost date, meaning if you had a medical bill during the gap, you can back pay and it will still be covered. The plan can include you, your spouse, and any dependents. So the pros, up to 18 months of coverage with 60 days to get yourself together and apply for it, with coverage including that gap. The cons, very expensive. Now let's look at our other options. You can always go the route of healthcare marketplace. Losing employer coverage qualifies you for a special enrollment period, or SEP. Like COBRA, you can sign up within 60 days of losing coverage. Now your premium depends on income, household size, and where in the US you live. Most people qualify for premium tax credits that lower monthly costs, sometimes drastically. All marketplace plans must include doctor visits, hospital care, prescriptions, mental health services, preventative care, maternity, and emergency care. There are no exclusions for pre-existing conditions. There are still a few other options if COBRA and the healthcare marketplace don't feel right for you. If your spouse or domestic partner has insurance, you can join their plan within 30 days. If your income will drop significantly during your job hunting, you may qualify for Medicaid. Enrollment is year-round and it can cover you retroactively in some states. Look, you can't always control when the layoffs happen, but you can control what happens next. By knowing your deadlines, your options, and your rights, you've already taken the hardest step staying proactive when it feels impossible. So take a deep breath, make your list, and remember, even in the middle of chaos, you still took the time to learn something new. And I think that just made you a smarter patient. Thank you for listening to Smarter Patients. I'm Alana Jacqueline. Find me on Instagram and TikTok at @Alana_Jacqueline and on Facebook and YouTube at Alana Jacqueline Official. And if you want the step-by-step guide from today's episode, visit smarterpatientspodcast.com.